Okay, so welcome to episode 2, where I'd like to discuss a bit about physician suicide, because I think it's a really important topic, and I think that people that are inclined to link to a page about physician burnout are likely, or a channel about physician burnout are likely people that have at least contemplated suicide. Or they may be contemplating suicide, or they know someone that has, or whatever. So I want to talk about that. And there are 2 different articles that I am drawing some information from. Both are Medscape. One is called National Physician Burnout, Depression and Suicide Report, which they did for 2019, published at January 16th, 2019. And that was by Leslie Kane. And then there's another article called Breaking Through the Cloud of Silence, and that was published on January 21st, 2020 by Alicia Gallegos. And the second one just very briefly highlights an emergency room physician who was living in Washington State, gonna keep all names anonymous, and he had been practicing for 30 years, had done a lot of good for a lot of people, had been dealing with mental health issues for the majority of his career, depression, and it had flared up several times throughout his career, secondary to unsupportive work environments or to moves. He had been gone through a few different litigation cases before, which can happen sometimes with ER docs, or any doc really, and this is geared toward, of course, physicians, PAs, nurse practitioners, nurses. So again, this is not just for physicians, but this guy just happened to be the physician. And what he found was that as his depression got worse, his depression got worse because he ended up in a litigation case, essentially, and he was finding himself deteriorating mentally as this case was drawing on. It was only like a 2-month time period from basically when he decided to retire from medicine. He felt really burned out and decided to retire. Shortly after that decision, he found out that he was being sued, and then within 2 months he had committed suicide, essentially. And the article goes on to explain how he found it difficult to be taken seriously by his psychiatrist / psychologist, that he was not doing well and decompensating. And so that kind of highlighted for me that I need to talk about some warning signs regarding suicide, as well as stressors, as well as some of the special challenges that physicians and medical providers can run into regarding mental health and getting their needs addressed properly. Because a lot of times, if you work in the field of medicine, you're kind of glossed over, you're ignored, you're relegated to a different category. You're deemed to be special, so your stress is not the same as everyone else's stress, because you're already considered to be Superman or Superwoman. The super PA, the super nurse practitioner, the one who's always there for everyone else, and your needs can and often do get overlooked, and that can have really detrimental consequences, as ended up happening with this gentleman. He was, again, very highly esteemed emergency room physician, had written several books and had done some I think various educational programs, if I'm not mistaken, and was really a pillar of his community. And he absolutely came unglued. And there is a quote, which if I can find it here, I want to read. Actually, his wife said, opening up here, one of the quotes from her, and again, I'm not naming any names, she said, if I can find it, she said, "I can honestly say that I've never personally seen anyone suffer the way that I saw my husband suffering." At the end, he was done. He was so tired, he just couldn't handle it anymore. And so he had decided to retire actually at the end of January 22nd, 2017. So January 22nd, 2017, he died of suicide on March 28th, 2019. So I said 2 months. I apologize. It wasn't 2 months. It was 2 years. But the litigation proceedings went over a course of like a 2-year time period. And at the end of that 2-year time period, he was completely at the end of his rope. He was already suffering with mental health issues to begin with, and was already completely burned out by his profession to begin with, which is why he was leaving emergency medicine. And then on top of that, the litigation proceedings basically just kind of pushed him over the edge, and he wasn't able to recover. And he was overlooked to a large extent because of the fact that he was viewed as being special, that nothing could be wrong with him because he was a physician, or that he wouldn't be suffering like other people could be suffering. So go through a few statistics here, and sorry for looking at my notes so much, but I don't have it all memorized. So in this 2019 survey, 44% of physicians are burned out. 41% of the physicians cope with burnout via self-isolation. Every day, one physician commits suicide in the United States. It's the highest suicide rate of any profession, or roughly 28 to 40 physicians per 100,000 end up committing suicide, which roughly translates to 400 a year. 64% of physicians polled do not plan to seek help for burnout and depression and have not sought help in the past. 13% are actively seeking professional help, and 3% are on the fence and planning to seek help. And there's some other numbers and percentages in there, but those were the ones that stood out to me. Physicians that die by suicide are likely to be older than non-physicians. They're more likely to be married at the time of their death. Don't understand that one, because marriage is supposed to be a supportive mechanism, but for some reason they're more often to be married at the time of death. And their mean age is 59 years old versus 47 for non-physicians. Physician suicides, more often than not, they had a known mental illness at the time compared to non-physicians. Interesting statistic for medical students: 129,000 medical students in 47 countries were polled. 27% of them were showing signs of depression or depressive symptoms. 11% of these 129,000 medical students were already contemplating suicide. They already had suicidal ideation. Many physicians don't seek help because of shame and anxiety and embarrassment. They feel like they're going to be judged by their peers, and very often their peers, again, sort of dehumanize them from the standpoint of thinking, well, this person's Superman or Superwoman, and what's more, they're a physician or they're a nurse practitioner or a PA, and I'm not really sure how to deal with that. So they tend to kind of shy away, and as a result of that, a lot of this can get swept under the rug. There's a stigma, obviously, that goes with voicing your mental health concerns and your burnout issues. So as a result, physicians face obstacles in finding mental health care and receiving effective treatment. Physicians avoid treating other doctors. They're often intimidated, and docs don't keep a close eye on physician patients. And the physicians actually may require closer inspection and a different approach because they're so used to compensating and looking like nothing is bothering them. They're so used to putting on a poker face. They're so used to putting up a front so that they can go about their day-to-day activities that it may be not as obvious. So you need to look for, it's good to look for warning signs, like withdrawal, isolation, sadness, someone that is not sleeping well, someone that's losing weight, someone that is, like we talked about, isolating or not, or maybe not acting themselves. There are resources that are being implemented in some hospitals, like peer-to-peer support groups or group support services. I think that the best thing we can do as medical professionals is just to look after each other. So if you see someone that you know is acting differently, that's not acting themselves, it's really a good idea to ask them if they're doing okay. Pull them aside into a room if you have to, close the door, say, hey, you know, I've noticed that you look different, your facial expression is off, or you're acting differently, you seem irritable, you seem jumpy, you seem like you're not well rested, you seem like you're losing weight, you seem angry, you seem down. Whatever it is that you're seeing, and offer to them, hey, do you need to talk to somebody? Do you need to talk to your pastor? Do you need to go see a counselor? Because they may require your help in breaking through the stigma that's attached to it, because the way that we were taught as medical professionals is that you just kind of bite the bullet and keep pressing forward because the patient is your priority, and you are basically second priority. And that is something that's deeply instilled in us in our medical training from day one. And so that becomes very difficult to overcome, and something that can really have deleterious effects on someone if it's gone too far. There's a certain point where it goes too far and can reach the point of no return. So it's really important to kind of keep your eyes open. Okay, so a couple different resources, and I'll see if I can find a way to link them onto the description perhaps. I think that's where I'm going to put them. If you see someone that is having issues and you're concerned about them burning out, particularly to the point of suicide or suicidal thoughts, suicidal ideation, please visit or steer them to suicidepreventionlifeline.org. And again, it is www.suicidepreventionlifeline.org, or have them contact the National Suicide Prevention Hotline at 1-800-273-8255. And again, it's the National Suicide Prevention Hotline, 1-800-273-8255. And hopefully this is helpful and can prevent people from going unseen and unheard, and can help burnout / mental health issues from going unaddressed, and most importantly, prevent people from hurting themselves or committing suicide, because it really is preventable, and help is out there. Please keep your eyes open, look after yourselves and your colleagues, and because we all need to support each other. Okay? Thank you for watching. I hope it was helpful, and there'll be more to come. Thank you.